Are you suffering from sciatic nerve pain that runs down your leg and can't find lasting relief? Today, I'll reveal how just one specific fruit can become your greatest ally in combating sciatic nerve inflammation and providing the relief you've been searching for. This is no longer an empty promise, but a scientifically proven solution that thousands of people are already using to restore their quality of life. I'd love to hear where you're watching from today. Leave a comment below telling me where you live and how you're dealing with your sciatica. And don't forget to subscribe to the channel and turn on notifications so you don't miss any valuable tips on natural sciatica pain relief. The sciatic nerve is the largest and longest nerve in the human body, extending from the lower back to the toes, approximately 2 centimeters wide at its origin. This complex nerve is formed by the union of 5 nerve roots that emerge from the spinal cord between the L4 and S3 vertebrae. When this nerve is compressed, irritated, or inflamed, the result is a characteristic pain that can be devastating for those who experience it. Statistically, approximately 40% of the world's population will experience sciatic pain at some point in their lives, with this condition primarily affecting people between 40 and 60 years of age. In Brazil, data from the Ministry of Health indicate that more than 15 million people suffer from some type of sciatic nerve pain, representing a significant public health problem that directly impacts the population's productivity and quality of life. Sciatic nerve inflammation, known scientifically as sciatica, can have several underlying causes. Lumbar disc herniation accounts for approximately 90% of cases, followed by spinal stenosis, piriformis syndrome, spondylolisthesis, and rare spinal tumors. Regardless of the primary cause, the common denominator in all these cases is the inflammatory process that develops around the nerve, perpetuating pain and limiting mobility. What many people don't understand is that diet plays a fundamental role in controlling bodily inflammation. Our bodies possess a complex system of inflammatory mediators, including pro-inflammatory cytokines such as interleukin-1, interleukin-6, and tumor necrosis factor alpha, which, when imbalanced, perpetuate chronic inflammatory processes. On the other hand, there are natural anti-inflammatory substances that can be obtained through proper nutrition. Recent scientific studies have shown that certain bioactive compounds present in specific fruits have potent anti-inflammatory properties, capable of modulating the immune response and significantly reducing inflammatory markers in the body. These compounds act on multiple molecular pathways, inhibiting inflammatory enzymes such as cyclooxygenase 2 and lipoxygenase, in addition to regulating the expression of genes related to inflammation. The fruit I'm going to introduce today isn't just another healthy addition to your diet, but rather a veritable natural pharmacy that concentrates unique compounds capable of crossing the blood-brain barrier and exerting anti-inflammatory effects directly on the nervous system. This revolutionary discovery has been the subject of intense studies at renowned universities around the world, with results that surprise even the most experienced researchers. Imagine having in your hands a natural, affordable, and delicious solution that can be easily incorporated into your daily routine, providing progressive and lasting relief from your sciatic pain. This specific fruit contains a unique combination of antioxidants, flavonoids, and phenolic compounds that work synergistically to combat inflammation more effectively than many conventional medications, without the unwanted side effects. The cherry, specifically the sour cherry, is emerging as one of the most powerful fruits for combating sciatic nerve inflammation. This small red fruit contains an extraordinary amount of bioactive compounds that make it a true natural remedy for those suffering from sciatic pain. Unlike other fruits that have moderate anti-inflammatory properties, the tart cherry has exceptionally high concentrations of anthocyanins, unique flavonoids responsible for its characteristic color, and, more importantly, its powerful therapeutic effects. The anthocyanins present in tart cherries, primarily cyanidin-3 glucoside and pelargonidin-3 rutinoside, have specific molecular structures that give them the ability to easily cross cell membranes and exert direct anti-inflammatory effects on nervous tissue. Studies conducted at the University of Michigan have shown that these substances can reduce C-reactive protein levels, one of the body's main inflammatory markers, by up to 60% in just 2 weeks of regular consumption. The most impressive study on the effects of cherries on nerve inflammation was published in the Journal of Nutritional Biochemistry, where scientists observed that patients with sciatica who consumed concentrated tart cherry juice for 4 weeks showed significant reductions in levels of interleukin-6 and tumor necrosis factor alpha, 2 cytokines directly involved in perpetuating sciatic nerve inflammation. The results were so dramatic that some patients reported an improvement in pain intensity of over 70%. The mechanism of action of cherries in combating sciatic nerve inflammation is multifactorial and extremely sophisticated. First, anthocyanins selectively inhibit the enzyme cyclooxygenase 2, responsible for the production of inflammatory prostaglandins, without affecting cyclooxygenase 1, which has important protective functions in the body. This selectivity is crucial, as it avoids the gastrointestinal side effects common to synthetic anti-inflammatories, offering pain relief without compromising digestive health. Furthermore, tart cherries contain surprisingly high levels of natural melatonin, approximately 6 times higher than other fruits. Melatonin not only acts as a sleep regulator but also as a potent neuroprotective antioxidant, capable of reducing oxidative stress in nerve tissue and facilitating cellular repair processes. This property is particularly important for people with sciatica, as oxidative stress perpetuates inflammation and delays the healing of damaged tissues. Randomized clinical studies have shown that the concentration of phenolic compounds in tart cherries is approximately 5 times higher than in sweet cherries, explaining their therapeutic superiority. These phenolic compounds, including chlorogenic acid, neochlorogenic acid, and quercetin, act synergistically to modulate the immune response, reducing the activation of inflammatory cells such as macrophages and neutrophils in the region affected by the compressed sciatic nerve. The bioavailability of cherries' active compounds is another factor that sets them apart from other anti-inflammatory fruits. Pharmacological research indicates that tart cherry anthocyanins are rapidly absorbed in the small intestine, reaching peak plasma concentrations between 1 and 2 hours after consumption. Even more impressive, these compounds remain active in the body for up to 12 hours, providing a prolonged anti-inflammatory effect that may benefit patients with chronic sciatic pain. Have you ever imagined that such a small fruit could contain more than 15 different types of anthocyanins, each with specific therapeutic properties? The variety and concentration of these compounds in tart cherries significantly surpasses other red fruits traditionally considered anti-inflammatory, such as blueberries and raspberries. This molecular diversity is crucial, as different anthocyanins act on distinct inflammatory pathways, providing a more comprehensive and effective therapeutic effect. Longitudinal studies have followed patients with sciatica who incorporated tart cherries into their diet for 6 months, observing not only a significant reduction in pain, but also improved sleep quality, reduced morning stiffness, and increased functional capacity. These additional benefits are attributed to the fruit's systemic anti-inflammatory effect, which benefits not only the affected sciatic nerve, but the entire musculoskeletal system. Scientific research continues to reveal new mechanisms by which cherries exert their beneficial effects. Recent discoveries indicate that tart cherry compounds can influence the expression of inflammation-related genes, promoting a genetic profile more favorable to the resolution of chronic inflammatory processes. This epigenetic modulation represents a new frontier in the natural treatment of sciatica, offering hope for lasting relief and complete recovery. Now that you understand the scientific power of tart cherries in combating sciatic nerve inflammation, it's crucial to learn how to incorporate them correctly into your routine to maximize their therapeutic benefits. The method of consumption, quantity, timing, and specific combinations can determine the difference between mediocre results and a significant transformation in your quality of life. Many people make crucial mistakes when preparing and consuming tart cherries, missing out on much of their anti-inflammatory potential. The first fundamental consideration is choosing between fresh cherries, concentrated juice, extract, or supplement. Comparative studies show that concentrated tart cherry juice has the highest bioavailability of active compounds, followed by fresh fruit and then standardized extracts. Concentrated juice undergoes a concentration process that removes water but fully preserves anthocyanins and other bioactive compounds, resulting in a concentration up to 8 times greater than that of fresh fruit. To achieve significant therapeutic effects in relieving sciatic pain, the recommended dosage is 300 milliliters of tart cherry juice concentrate daily, divided into 2 doses of 150 milliliters each. This amount provides approximately 50 to 70 milligrams of anthocyanins per day, a concentration shown in clinical studies to be effective in reducing inflammatory markers. If you opt for fresh fruit, you would need to consume between 200 and 300 tart cherries daily to achieve the same concentration of active compounds. Timing is as important as quantity. The first dose should preferably be consumed on an empty stomach approximately 30 minutes before breakfast, when an empty stomach allows for maximum absorption of the bioactive compounds. The second dose should be taken 2 hours after dinner, taking advantage of the natural peak of intestinal absorption at night and enhancing the effects of the natural melatonin present in cherries to improve sleep quality, often compromised by sciatic pain. The temperature at which you consume it also significantly influences the bioavailability of the active compounds. Cherry juice should be consumed at room temperature or slightly chilled, never heated, as temperatures above 40 degrees Celsius can degrade the thermolabile anthocyanins. If you prefer a less acidic flavor, you can dilute the juice concentrate with filtered water in a 1-to-1 ratio, maintaining therapeutic efficacy while improving palatability. Synergistic combinations can dramatically enhance the anti-inflammatory effects of tart cherries. Adding a teaspoon of freshly grated ginger to tart cherry juice creates a powerful synergy, as the gingerol in ginger acts on inflammatory pathways that complement the anthocyanins in tart cherries. This combination was tested in a pilot study with sciatica patients, demonstrating an additional 20% reduction in pain intensity compared to using tart cherries alone. Another extremely effective combination is mixing cherry juice with fresh pineapple. The bromelain in pineapple is a natural proteolytic enzyme that helps reduce edema and tissue inflammation, perfectly complementing the effects of cherry anthocyanins. The ideal ratio is 200 milliliters of cherry juice to 100 milliliters of fresh pineapple juice, creating a drink that is not only therapeutic but also delicious and refreshing. For people suffering from digestive problems, an effective strategy is to consume cherry juice along with foods rich in healthy fats, such as avocado or nuts. Anthocyanins are fat-soluble compounds that are absorbed more easily in the presence of lipids, in addition to reducing potential gastric irritation in people with sensitive stomachs. A smoothie made with cherry juice, half an avocado, and some nuts is an excellent therapeutic and nutritional option. Proper storage of cherry juice is crucial to preserving its active compounds. Once opened, the concentrated juice should be kept refrigerated and consumed within 7 days, as exposure to oxygen and light progressively degrades anthocyanins. For long-term consumption, a smart strategy is to divide large bottles into smaller portions and freeze them, thawing them as needed for weekly consumption. Did you know that cherry harvesting season directly influences the concentration of anti-inflammatory compounds? Cherries harvested late in the season, when fully ripe, have anthocyanin concentrations up to 40% higher than those harvested early. Therefore, when choosing commercial juices, choose those that specify the use of ripe, late-harvested cherries, usually indicated on the label as late harvest or fully ripened. For people with specific dietary restrictions, such as diabetes, it's important to consider the glycemic index of tart cherries. Fortunately, tart cherries have a relatively low glycemic index, between 25 and 30, allowing them to be safely consumed by diabetics when properly incorporated into a diet. The presence of fiber and phenolic compounds in cherries also helps modulate the glycemic response, making them a safe option for most people. Consistent consumption is absolutely essential to achieve significant therapeutic results. Unlike medications that can provide immediate relief, the natural compounds in cherries need time to exert their anti-inflammatory and neuroprotective effects. Studies indicate that the first signs of improvement in sciatic pain can be seen after 1 to 2 weeks of regular consumption, with maximum benefits achieved between 4 and 6 weeks of consistent use. To achieve exceptional results in relieving sciatic pain with tart cherries, it's essential to implement an advanced protocol that goes far beyond simply consuming the fruit. Optimizing results involves sophisticated chronobiology strategies, specific synergistic combinations, gut microbiota modulation, and absorption-boosting techniques that can amplify anti-inflammatory effects by up to 200% compared to standard use. The concept of chronobiology applied to tart cherry consumption represents a revolution in the natural treatment of sciatica. Our bodies follow specific circadian rhythms for the production of digestive enzymes, intestinal absorption, and metabolism of bioactive compounds. Recent research from Harvard University has shown that consuming anthocyanins during peak intestinal absorption, which occurs between 7 and 9 a.m. and 7 and 10 p.m., can increase bioavailability by up to 150%. The optimized chronobiological protocol consists of 3 strategic doses. The first dose of 120 milliliters at 7 a.m. on an empty stomach, a second dose of 80 milliliters at 3 p.m. to maintain stable plasma levels, and a third dose of 120 milliliters at 8 p.m. to maximize nocturnal absorption and take advantage of the effects of natural melatonin. This temporal distribution maintains therapeutic concentrations of anthocyanins in the body for 24 hours, providing continuous relief from sciatic nerve inflammation. Modulating the gut microbiota represents another fundamental pillar in optimizing results. Recent studies have revealed that certain beneficial gut bacteria, particularly Lactobacillus plantarum and Bifidobacterium longum, are capable of metabolizing anthocyanins into even more bioactive and anti-inflammatory metabolites. Supplementing with specific probiotics 2 weeks before starting the Cherry Protocol can significantly increase the production of these beneficial metabolites. The microbiota preparation protocol involves the daily consumption of 200 billion colony-forming units of specific probiotics, combined with natural prebiotics such as inulin and fructooligosaccharides found in foods like artichokes, garlic, and onions. This preparation creates an optimized intestinal environment for maximum conversion of cherry anthocyanins into even more potent therapeutic compounds. Advanced combinations with other bioactive compounds can create extraordinary synergistic effects. The combination of tart cherries with liposomal curcumin represents one of the most promising strategies identified in recent research. Curcumin acts on inflammatory pathways in a complementary manner to anthocyanins, while its liposomal formulation ensures superior absorption. The ideal protocol involves consuming 500 milligrams of liposomal curcumin 30 minutes before each dose of tart cherry juice, creating a window of synergistic absorption. Another revolutionary combination is the addition of piperine, the active compound in black pepper, which can increase anthocyanin absorption by up to 2,000%. A tiny pinch of freshly ground black pepper added to cherry juice, while it may seem strange, represents one of the most effective strategies for enhancing therapeutic effects. Piperine inhibits liver enzymes responsible for the rapid metabolization of anthocyanins, prolonging their persistence in the body. The strategic cycling technique can prevent the body from adapting and maintain therapeutic efficacy in the long term. After 6 weeks of continuous consumption, a 1-week break allows cellular receptors to resensitize to the cherry compounds, preventing the decrease in efficacy observed in some users after prolonged use. During this break, other anti-inflammatory fruits such as acai or blueberries can be consumed to maintain some level of antioxidant protection. Water aerobics or aquatic exercises performed approximately 2 hours after consuming the morning dose of tart cherries significantly enhance the anti-inflammatory effects. Increased circulation during exercise facilitates the distribution of bioactive compounds to the affected tissues, while the hydrostatic pressure of the water reduces edema and facilitates lymphatic drainage in the lower back. This combined protocol has demonstrated superior efficacy in preliminary studies with patients with chronic sciatica. Objective monitoring of results using validated pain scales and serum inflammatory markers allows for precise protocol adjustments. The visual analog pain scale should be recorded daily at the same time, preferably at 8 p.m., to identify patterns of improvement. Laboratory tests for C-reactive protein and erythrocyte sedimentation rate performed every 4 weeks provide objective data on the reduction of systemic inflammation. Did you know that combining tart cherries with controlled intermittent fasting can dramatically amplify their anti-inflammatory effects? A 16-hour fast, consuming only water and cherry juice, activates cellular autophagy pathways that remove damaged inflammatory proteins and facilitate tissue regeneration. This advanced protocol should be implemented gradually and always under professional guidance. Supplementing with high-quality omega-3s, specifically marine EPA and DHA, creates a powerful synergy with cherry anthocyanins. While omega-3s provide a substrate for the production of specialized anti-inflammatory mediators such as resolvins and protectins, anthocyanins enhance the activity of these substances. The ideal dosage is 2 grams of omega-3s daily, consumed alongside the nightly dose of cherries to maximize the absorption of both compounds. Diaphragmatic breathing techniques performed immediately after tart cherry consumption can increase tissue oxygenation and facilitate cellular repair processes. Deep, controlled breathing activates the parasympathetic nervous system, creating a physiological environment conducive to resolving inflammation and healing injured tissues around the sciatic nerve. Sleep quality plays a crucial role in optimizing results, and the natural melatonin in cherries can be enhanced through proper sleep hygiene. Keeping the bedroom completely dark, with a temperature between 18 and 20 degrees Celsius, and avoiding electronic devices 2 hours before bed maximizes endogenous melatonin production and enhances the neuroprotective effects of tart cherries. After thoroughly exploring the therapeutic power of tart cherries in combating sciatic nerve inflammation, it's crucial to address important considerations that will ensure their safety and maximize the benefits obtained. Like any therapeutic intervention, even natural ones, the use of tart cherries requires specific care, knowledge of potential interactions, and recognition of situations that require specialized medical monitoring. While tart cherries are considered safe for most people, there are specific situations that require special attention. People with a history of kidney stones should be aware that cherries contain natural oxalates, which, in excessive amounts, can contribute to the formation of new stones in predisposed individuals. The recommended dose in the therapeutic protocol does not pose a significant risk, but medical monitoring is advisable for people with a recurrent history of nephrolithiasis. Diabetics and pre-diabetics should carefully monitor their blood glucose levels when beginning the tart cherry protocol. Despite the relatively low glycemic index, consuming 300 milliliters of concentrated juice daily adds approximately 40 grams of natural carbohydrates to the diet. Adjustments to medication or the diet plan may be necessary, always under the guidance of the endocrinologist responsible for monitoring. Individuals taking anticoagulant medications such as warfarin should exercise special caution, as studies indicate that regular tart cherry consumption may slightly enhance anticoagulant effects due to the presence of compounds that affect platelet aggregation. While this effect is generally beneficial, dosage adjustments may be necessary through more frequent monitoring of prothrombin time. People with irritable bowel syndrome or inflammatory bowel disease may experience initial digestive discomfort due to cherry's natural acidity and soluble fiber content. In these cases, it's recommended to start with smaller doses, 50 milliliters twice daily, gradually increasing according to digestive tolerance. Diluting the dose in water and consuming it with food can minimize potential gastrointestinal irritation. Tart cherries may interact with some specific medications, particularly those metabolized by the liver enzymes CYP3A4 and CYP2D6. Non-steroidal anti-inflammatory drugs may have their effects potentiated when combined with regular cherry consumption, possibly requiring dosage reduction under medical supervision. This interaction, while generally beneficial in allowing for lower doses of synthetic medications, should be carefully monitored. Hypertension medications, especially ACE inhibitors and calcium channel blockers, may have their effects slightly amplified due to the natural vasodilatory properties of anthocyanins. Hypertensive patients should monitor their blood pressure more frequently during the first weeks of the protocol and report any significant changes to their cardiologist. People allergic to fruits from the Rosaceae family, which includes cherries, peaches, plums, and apricots, should obviously avoid the tart cherry protocol. Allergic reactions can range from mild symptoms like oral itching to more severe reactions like glottis edema. Any sign of an allergic reaction should prompt immediate discontinuation of consumption and medical attention. Some situations related to sciatica constitute medical emergencies and require immediate attention, regardless of the use of natural treatments. Cauda equina syndrome, characterized by loss of sphincter control, numbness in the genital region, and progressive weakness in both legs, represents a neurological emergency that can result in permanent paralysis if not treated promptly. Sciatic pain accompanied by fever, especially above 38 degrees Celsius, may indicate a serious spinal infection such as osteomyelitis or an epidural abscess, conditions that require urgent antibiotic therapy and possible surgery. Any sudden and severe worsening of pain, especially if accompanied by progressive neurological signs, should be immediately evaluated by a neurosurgeon or neurologist. If after 6 weeks of correctly implementing the tart cherry protocol, there is no significant improvement in symptoms, it is essential to seek specialized medical reevaluation. Persistent pain may indicate underlying causes that require specific interventions, such as spinal tumors, severe spinal stenosis, or other conditions that do not respond adequately to conservative treatments. To ensure maximum safety and tolerability, implement the tart cherry protocol gradually over 2 weeks. In the first week, consume only 50 milliliters of concentrated juice in the morning on an empty stomach, carefully monitoring for any adverse reactions. In the second week, add a second dose of 50 milliliters in the evening. From the third week onward, gradually increase to the full therapeutic dose of 150 milliliters twice daily. Keep a detailed diary recording your pain intensity on a scale of 0 to 10, sleep quality, bowel function, and any side effects you experience daily. This record will be invaluable for monitoring progress and making necessary adjustments to the protocol, as well as providing important information to healthcare professionals monitoring your case. If this video was helpful to you and brought hope for natural relief from your sciatica, please click the like button so this content can reach more people suffering from this debilitating condition. Your like not only motivates me to continue researching and sharing natural solutions based on scientific evidence, but it also helps the YouTube algorithm show this video to others who need this valuable information. Leave a detailed comment sharing your experience with sciatic nerve pain, how long you've suffered from this condition, what treatments you've tried, and how you plan to implement the tart cherry protocol I shared today. Your experience is extremely valuable to our community and can inspire others going through the same thing. I read all comments personally and, whenever possible, respond with additional personalized guidance. Subscribe to the channel and turn on notifications by clicking the bell, as I'm constantly publishing new content on natural treatments for sciatica, herniated discs, osteoarthritis, and other musculoskeletal conditions. I've been preparing a special series on specific exercises for each type of sciatica, which will be released in the coming weeks. Don't miss this information that can transform your quality of life. Share this video with someone who also suffers from sciatica. Whether it's a family member, friend, or coworker, you may be offering a natural solution they never knew existed. Use the share button to share via WhatsApp, Facebook, or any other social network. Remember, your recommendation could be the first step towards someone regaining their mobility and well-being. And let me know in the comments what sciatic nerve topic you'd like to see in the next video. I'm preparing content on specific exercises for sciatica, other anti-inflammatory fruits and foods, stretching techniques, proper posture for those with sciatica, and much more. Your suggestion could become the next video that helps thousands of people live free from sciatica pain. Always remember that nature offers us powerful solutions, and that with the right knowledge and consistent application, it is possible to restore your quality of life and live free from sciatic pain. Sour cherries can be the beginning of your journey to natural and lasting recovery.